as the topic of today's video is humerus. So let's start with its introduction. First of all, it is the longest bone of upper limb among the 32 bones present. Second one, it is the bone of arm, means the single bone of upper arm. Now let's start with its side determination. Side determination is known as the position in which the bone is placed in our body. In side determination, we have upper end that is rounded, lower end that is flattened, and a head that is directed medially. Below head, we have lesser tubercle. Lesser tubercle is a bump-like structure that is present below head. ठीक है? Then we have a bicipital groove or intertubercular sulcus. Bicipital groove or intertubercular sulcus is surrounded by the greater tubercle and the lesser tubercle. ठीक. Now let's start with the features of humerus. Humerus consists of three parts. The first one is upper end. Then we have shaft and the lower end. Now we will study upper end, shaft and lower end in the detail. In upper end, firstly we have head. Head is directed medially, backwards and upwards. It articulates with the glenoid cavity of scapula to form the shoulder joint. Now, in upper end of humerus, we have three types of neck: anatomical neck, surgical neck, and the morphological neck. Anatomical neck is the first one that separates head from the upper end. Here we have anatomical neck. It is separating the head portion with the upper end of the bone. Now we have surgical neck. Surgical neck separates upper end from the shaft. Here we have surgical neck. This is the whole upper end, and below this we have shaft. This is the surgical neck separating the upper end from the shaft. Now third one we have morphological neck. Morphological neck, as you can see, it is placed above surgical neck. Most probably it has the distance like 0.5 inches between surgical neck and the morphological neck. Now the next one we have in upper end is the greater tubercle. Greater tubercle forms the lateral part of the upper end. And the next one, greater tubercle. Here we have greater tubercle. It forms the lateral part, as this one is the lateral border. So the greater tubercle forms the lateral part. And the next one we have lesser tubercle. Like this is our anterior border. So the lesser tubercle is an elevation or bump like structure present on the anterior aspect of upper end. The last we have in upper end is the intertubercular sulcus, or also named as bicipital groove. This one separates lesser tubercle. Medially from anterior part of the greater tubercle. Now let's come on up on the shaft. Shaft consists of three borders: anterior border, lateral border and medial border. And then we have surfaces: anterolateral surface, anteromedial surface and the posterior surface. Here anterior border, where this is the anterior border. Anterior border is anterior border is divided into three parts: upper one, middle one and the lower one. Upper 1/3 of anterior border forms the intertubercular sulcus. Here we have intertubercular sulcus. Therefore anterior border is continued till here. So the upper 1/3 end of the anterior border forms a lateral lip of intertubercular sulcus. In middle we have deltoid tuberosity, and the lower half of anterior border is smooth and rounded. Now let's jump up to the lateral border. Lateral border, here it is the lateral border. Okay, in lateral border again we have three things: upper one, middle one and lower one. Upper one forms greater tubercle, which is barely traceable. We can't properly see this. Second, in middle we have radial or spiral groove, and the third one is lower one, which forms lateral supracondylar ridge. The third part हमारा लेटरल बॉर्डर का जो लास्ट पार्ट है मीन्स द लोअर एंड इट इज प्रोमिनेंट एंड इट कंटिन्यूज विद द लेटरल सुप्राकॉन्डाइलर रिज. नाउ वी हैव medial border. Again medial border has upper part, middle part and the lower part. The upper part of medial border forms the medial lip of intertubercular sulcus, and then again it is middle one is rough strip like structure, and then medial border continues here with the medial supracondylar ridge. Okay, now let's jump up on the lower end. We have a lower end in humerus. It has articular parts as well non-articular parts. In articular parts of the humerus we have capitulum. This capitulum is a rounded projection which articulates with the head of the radius. And the second one we have trochlea. Trochlea is like pulley shaped. ठीक है, then it articulates with the trochlear notch of ulna. The first one like capitulum articulates with the head of radius, and the second one trochlea articulates with trochlear notch of ulna. Then non-articular parts, we have 7 non-articular parts. First one is medial epicondyle, lateral supracondylar ridge, and medial supracondylar ridge. 4 are the main ones. Medial epicondyle is the prominent bony projection. Here we have medial epicondyle. It is like bony projection on the medial aspect. Then we have lateral epicondyle. The lateral epicondyle is smaller, like it is smaller than the medial epicondyle. Now we have lateral supracondylar. Let's start with coronoid fossa. Coronoid fossa is the depression on uh, anterior aspect of trochlea. Here we have trachea, and this is like coronoid fossa. It is depression, or we can say hole like structure. When we touch the bone, it is the depressed part that is known as coronoid fossa. Now it is radial fossa. Radial fossa is the depression just above anterior part of capitulum. Here we have capitulum, and here we have fossa, that is radial fossa. And the last one is olecranon fossa. When we turn on the bone, we see the posterior aspect here. It is the posterior aspect of the bone. So this is the fossa that is known as olecranon fossa. Okay, now the deltoid tuberosity. Deltoid tuberosity is present on anterolateral surface between anterior and the lateral borders. Okay, now let's come up on the muscle attachments. The first one we have is the supraspinatus. Then we have infraspinatus, pectoralis major, deltoid, brachioradialis, pronator teres, and cornea subscapularis, latissimus dorsi, teres major, triceps brachii, coracobrachialis, brachialis, teres minor, brachialis. Now we have to know, like this is the diagram that we are studying. If it is bluish in color, then it represents about the insertion. If it is reddish in color, then it represents about the origin. And if we have green color, then it represents our ligaments. Okay, so like we have supraspinatus, so this is the insertion. Then again we have latissimus dorsi, teres major, coracobrachialis, deltoid. These are all the muscles or muscle attachments, we can say. This is the part that we have to learn. Now let's come upon the ossification part. Humerus consists of one primary ossification center and 7 secondary ossification centers. The upper end ossifies from 3 secondary centers, one for the head, one for the greater tubercle, and one for the lesser tubercle. The primary center appears in the middle of diaphysis during 8th week of development. Then we have lower end. The lower end ossifies from the 4 centers. 2 for the epiphysis, include one for capitulum and one for the trochlea. Now we have clinical anatomy of the humerus. The common sites of fractures of humerus are surgical neck, shaft, and supracondylar region. In surgical neck, we damage axillary nerve, in shaft, we damage radial nerve, and in the supracondylar region, we develop ulnar nerve, which is known as medial epicondyle fracture. Then we have supracondylar fracture. Supracondylar fracture is common in young age as it is caused by fall on the outstretched hand. If a person like a child falls on with the hand straight, then the lower fragment is displaced backwards. This causes the injury to median nerve and causing the Volkmann's ischemic contracture. This is the main points that we have to discuss in humerus. Thank you.